Welcome back to another episode from the Optimal Body Podcast. I'm Dr. Dom.
And I'm DocJen.
And today we're going to be talking about QL pain or your Quadratus lumborum that might be causing tightness or pain in your low back. So this is actually our second time talking about QL pain on a podcast episode, but really we want to hear from you. Are you somebody who has been told you have back pain from a tight Quadratus lumborum? Please comment below. What have you been told? What are the things that they told you to do to get rid of it? We really want to hear from you to hear what providers are telling people out there so we can better direct the content that we create. And make sure before you go, click that subscription button and notification bell because we have so many videos that will be able to help you and your body wherever you're at.
This is like a muscle that gets blamed for a lot of whether it's low back pain specific or maybe it's radiating into the hip. So we just want to bring an understanding. Now we've talked about the QL before, but this was quite a while back. And so I think updating the information, making sure that it's fresh in your mind. And if you have not been listening for that long, now you get to experience what we talk about with the QL and what you can really do, because you're probably here as someone who's been told your QL is the reason for your low back pain, or you need to stretch your QL, or we need to release your QL. And do we?
Yeah, the QL's, I feel like it's kind of used as a scapegoat in some of these scenarios. And the QL very well might be tight or, might be, but again, it's kind of the scapegoat because it's really not a huge or significant muscle in its function. It's kind of just this square shaped muscle that attaches on the top of our iliac crest and our low rib cage. And it's involved in helping extend the spine and laterally flex the spine and just give some stability between the rib cage and pelvis. But we have so many other major players in all of those movements. We've got our erector spinae muscles, which are the big ropey muscles that go up the center of our back that are our primary movers into extension. Same with the multifidi. We also have the transverse abdominis that wraps all the way around from our corset muscle that gives that stability in the same area from our rib cage to our pelvis. We've got the obliques, our abdominal obliques, the internal and external obliques that also help with rotation and side bending to some degree.
Yeah, and it really is what I think is one of the coolest aspects of it, because in reality, when we're talking about the overall force that it produces, when we're talking about, side bending and extension, it really only accounts for less than 10% of that bending and that lumbar extension, when in comparison of those larger back muscles. So I think that's really important to note. Like, this isn't the only muscle that's kind of bending you to the side, or that's not the only muscle we're working when we're doing exercises that are side bending. So it's really important to keep the whole aspect of the trunk, back, and core in mind when we're talking about the QL. And that already gives you an indication of then what we can start to work on, I think, and that's what's cool.
The next level is that like one of its other functions is that it's an accessory respiratory muscle, which essentially means it helps us breathe when we're doing forced inhalations. And the thing that I love about this being an accessory respiratory muscle is that it helps us expand through the low rib cage rather than our other accessory muscles, which get talked about more often, which is our upper chest muscles and our neck muscles. Jen and I talk about all the time in depth. We want to be breathing and expanding through that low rib cage. And furthermore, the QL has direct contacts into that diaphragm. The diaphragm has these arcuate ligaments that branch out and attach into the low back, same areas that the QL attach. So if we're breathing through the diaphragm, if we're using the QL and other lower intercostal muscles to expand through the low rib cage, that in itself is going to help bring relaxation to our QL, just through breath.
Which goes back to why it's so important to get that foundation of understanding where you're breathing from. Especially as women, I feel like we've been trained to kind of hold our bellies in and kind of keep our chests back and be in this good posture. But what we end up doing a lot of times is this opposite breath pattern, where as I breathe in, my belly actually comes in and I expand through my chest, and then as I breathe out, I let my belly relax, which is the opposite of what we want to be doing. When we breathe in, we want our belly to relax, but really not push out. We want that expansion from the sides and the back. And finding that expansion from the sides to the back actually takes work and actually takes practice, And I think it's also important to understand how integral the QL is into these fascial connections into the thoracolumbar fascia. So thoraco meaning thoracic, so upper back, lumbar meaning low back. So it's this huge fascial connection along our low back that connects into our QL as well. And there's integrations along that whole upper and low back that connect into how that QL is going to feel and respond based on the tension we may have throughout that entire fascia.
Not to mention the bottom portion of the QL then kind of connects into where the glutes are, and that's where our IT band, which is another massive thick portion of fascia that runs down that lateral line. So this is all to say that when we are moving and we have muscles that might be more dominant or less dominant, they're all tugging through these fascial planes. And if we have imbalances, the QL is going to be a part of that chain.
Yeah.
And as we mentioned, it's not the strongest muscle. It's not the most powerful mover. So it can get thrown around and taken advantage of a little bit. And that might be one of the reasons that we have tension or trigger points there.
Well, let's talk about what you might feel if you really are having QL pain.
QL pain will be characterized more by a deep aching. It's different from something like SI pain, where people will point in one spot when it comes to SI pain, and that might be described more as sharp. But QL pain is going to be more deep aching on the side of the body, and you will have this pain with extended sitting, pain with transitions from sitting to standing, or aching and pain in the mornings.
And you're usually kind of grabbing a little bit higher than your pelvic bone or where the SI is. It's a little bit you're kind of grabbing your back and
kind of in the side meat of the body.
Right.
Between the ribs and the pelvis.
And you can, if you put your hand, turn your hand and grab it around the back above your pelvis and then move your hip bone up. And you can kind of feel all that musculature where that QL and other muscles are involved, kind of starting to activate and move. And so it's usually around that area that people are starting to feel that deep ache and that pain around that area. And that's where we can, kind of attribute that to maybe some low back pain that you're having.
And it can almost mimic, because it's more of a diffuse aching pain, it can mimic other low back pain symptoms or even hip symptoms. Some people might think they have a hip bursitis, especially because where the QL is, we have a lot of nerves coming out of those low lumbar segments of the spine, and some of them run through or along the QL, and we can get nervy type entrapment. So we might also be feeling nervy type pains, tingling pains. Sometimes the symptoms will present a little bit differently and might mimic other symptoms of other conditions, but that's kind of the best way to group all of the QL type symptoms in one place.
Now we want to talk about, so what can I do, right? Because most of the time the treatments are so pinpointed, and trust me, as a physical therapist, I've done this myself. The point of getting hands-on treatment in a specific muscle is to cause relaxation of that muscle so that we can start to move in different patterns.
Which can be effective.
Which can be so effective. We're not releasing the tissue. We're not lengthening the tissue. We're not releasing fascia. These trigger points that we might feel into this QL area, just trigger points for the brain. Think of that. I'm alerting the brain that there's some tension and tightness there. And so if I can tap into that to cause some relaxation within that area, no matter what tool or technique that I'm using, you cannot use that alone, because what caused that tension, those trigger points and that tightness to develop in the first place? If we never address the root cause of what happened, you can continue to get all these treatments and feel better for the short term, but they're going to come back if we never get to the root cause of why.
So that being said, yes, manual treatment can be a part of your rehab or can be a part of your plan or process to get rid of this QL pain, but where else do we want to look? And with all that we mentioned, how the QL has interconnections all the way from essentially the knee to the neck, we really want to be focused all along that chain. Priority number one, though, is try the breath. Try that deep rib cage expansion. Get in a very comfortable position, whether it's laying on your back or sitting. Take some deep breaths. Focus on expansion through the low rib cage. As you exhale, nice long controlled exhales. That's going to help us downregulate that nervous system and really just downregulate tension throughout the whole body. But especially with the QL, because it has those connections directly into the diaphragm, it makes me think there's got to be a little more interplay there, where if we're doing effective diaphragmatic breathing, it's going to have a little more influence on the relaxation in the QL as well.
And one of my favorite techniques to kind of cause relaxation around the area, and especially when we're talking about, okay, it's so interconnected into the fascia along that whole upper and low back, is using the Quadratus ball from Tune Up Fitness. And this ball, you can kind of lay on your back. It's a super grippy material of the ball, and you just deflate it a little bit. And if you rotate around that ball, you kind of wind up the tissue, and you take a deep breath into that wound up tissue, and you relax into that and then unwind. And it's going to like feel like it's unwinding the tissue. I mean, there's so many nerve endings and everything that we're going to get to have that response to cause that relaxation, but you can do that all along the back. And then one tool that I specifically love, so this is again stuff that you can do on your own to cause that release type feeling and that relaxation, is using the IntelliRoll. The IntelliRoll, because of the design of this foam roller, actually has the like a divot on one of the main ends of it, and if you lay on your side on that, you can kind of open back and kind of come forward, but you can massage directly into that QL without laying on your back, without direct pressure of just like a ball. But this kind of helps to disperse that pressure to help to cause that better relaxation. Remember, the goal isn't that we're trying to use a lacrosse ball or super hard tool to like really dig into tissue, because that's digging into tissue isn't going to do anything. We're not breaking anything up. But if we can cause relaxation through the Quadratus ball, soft ball, or, you know, laying on this IntelliRoll that's designed for the low back and the QL to be affected in that area, we can really help to cause that relaxation on your own, and then get into some movement that we're going to talk about.
And one more reason that I love these tools is like people will still say, oh, that's passive tools. That's what you just talked about with massage. I think it's a step above a passive tool, because you're more actively in control of the pressure.
Yeah.
You have to be in control. And when you combine it with your breath and maybe some movement while you're doing it, it becomes more of an active and dynamic treatment. Again, that you have control over. You're doing it to yourself. It's not something someone is doing to you. And then once we have found that relaxation, this is where the real work takes place.
Yeah.
This is where we just want to get into some general movement. We want to be able to go through movements that may have previously felt restricted, or may have previously felt like it aggravated that pain, because now that we have the relaxation, we might have a little more variability to do those movements with less discomfort.
And this is where we want to, like, we talked about all the muscles that kind of combine and touch into this QL area, right? Which transverse abdominis, we talked about a lot, which is our inner core, our diaphragm. So going a step beyond just like getting back into good foundational diaphragmatic breathing, but then we want to get into good foundational deep core work, where we're understanding how to use that diaphragm and that transverse abdominis effectively together, so that we can get better dynamic support around that entire trunk and utilize more muscles, rather than our low back or QL taking over during core exercises. You know, we don't want them to dominate movement. We want more balance throughout the entire trunk and pelvis. So if we start to learn how to utilize your deeper core muscles, then we can take pressure off of just the QL kind of taking over or doing a lot. And that's where, again, it's like, okay, so getting this deep core understanding and then how that translates into functional and everyday movement is really important. And then one last thing is like, how do I get more hip control, right? So that when I bend, when I move, it's not just from my QL, but it's also like my hips are bending, and I'm using that glute power and that glute force to help the energy that I'm feeling all throughout my trunk.
And I think especially doing that in single leg variations, because then it's going to force you to use that deep core stabilization.
Yes.
And that's why starting with the deep core, perfect place to begin, because then when you transition into those other movements, you're going to prevent that QL from feeling like it's getting tugged around too much, because we have set the foundation, we've set that core stability, and now getting into stuff like a single leg deadlift, or even just an offset deadlift, doing lateral type lunges. doing single leg variations of step downs or step ups. Those are really going to help us use that QL in conjunction with all our other core muscles in a way that's effective and balanced, rather than before where something was out of whack and causing that QL to feel like it needed to tighten down and create stability.
Well, and what's funny too is like we didn't start this conversation by saying, okay, first you're going to do the QL stretch, then you're going to do side planks, then you're going to do...
That's what everyone says is the QL stretch. And even a lot of like research and studies that we looked up, they're like, oh, the side plank is the best exercise to get activation in the QL. Like, okay, that's great, but do we need more activation in the QL?
Yeah, what if we need to look at the other areas of the body?
Yeah, what if we need to just relax and then find out how to get to coordinate better with everything else?
Yes.
So yes, those exercises are great.
Yeah.
And when you're working on that deep core coordination, throw some side planks in there.
Yeah.
See how it feels. Throw some Copenhagens in there.
Yeah.
See how they feel. And that QL stretch feels amazing.
It does, just for like the whole lateral line, not even just the QL, but like everything from the lats all the way down the leg.
Which people call it the QL stretch, but it is like
it's a lateral
stretching
line stretch.
Lats, it's stretching QLs, it's stretching obliques, it's stretching all the way down through your glutes and through the IT band. It's putting tension on that whole line. So it does a lot more than just stretch the QL, and can be a great part to throw in with that mobility work you're doing on like the quadrispal and teleroll. Do a QL stretch and then get into some deep core work. And then we want to start working some of that single leg functional type movement to get everything working together.
Thanks so much for joining us on another episode. I hope you learned a little bit more. And if you're like, well, what movement should I be doing? We have a full body low impact plan on Gen Health that will take you through a lot of these single leg activities, this deep core understanding, and help you progress through 3 different phases. And you can try a week just free. And especially if you want to learn from us in terms of how we cue, how we get into that breath, into that body through different movements, I highly recommend this plan. So we'll have it linked up. I hope you join and just check it out. Just explore the week free. See what it feels like within your body, and hopefully we see you back on another episode.